Well, hello, and welcome to Module 8. So, what do Muhammad Ali, Michael J. Fox, and George H.W. Bush have in common? The answer is Parkinson's disease. This is a disorder of the central nervous system that affects movement. It has been estimated that over 10 million people worldwide are living with Parkinson's disease. What do Cameron Boyce, Prince, and Adam Horovitz have in common? The answer is seizure disorders. The incidence nationwide is 3.4 million. One more. What do Robin Williams, Charles Bronson, and Sugar Ray Robinson have in common? Alzheimer's. It is estimated that 5.6 million people over the age of 65 have Alzheimer's. Since these three diseases impact over 20 million people, you will likely be caring for one of these clients, or one of your family members may have them. You want to be familiar with the medication therapy that is associated with these different disorders. In our last module, you learned about the autonomic nervous system and the drugs to work on that system. We specifically talked about adrenergic receptors. In this module, you will build on Module 7 and learn more about autonomic drugs, particularly those that influence the cholinergic receptors. We will discuss cholinergic antagonists, such as atropine, which can be used to block cholinergic receptors and speed up the heart, and cholinergic agonists that can treat Alzheimer's disease by increasing brain levels of acetylcholine. Also, you will be learning about drugs to manage seizures and drugs to manage the symptoms of Parkinson's disease. Since these diseases are usually chronic and progressive, empowering the client to engage in good medication management is an important nursing role. Think sometimes the drug may not be working because the patient isn't even taking the drug. Maybe the drug is too expensive. It's the nurse's role to engage in conversation with the client to make sure that they understand the importance of the medication and means to getting that drug. So, how do you learn these drugs? Well, you will want to think about them in their categories, which is determined by their action, such as an anticholinergic. And then you want to think about what they're used to treat, such as an anti-seizure medication. The drug action will drive the side effects. For example, a seizure is a hyperactivity of the brain, so an anti-seizure medication works by quieting the brain. So the side effects are going to cause what? Well, the side effect, we think of too much action. So too much quieting of the brain would cause what? It would cause the brain to become slower. So we would notice decreased respiration, sleepiness, or central nervous system depression. As a nurse, you will be caring for your patient, administering these medications and monitoring for these side effects and communicating with the provider when you notice a change in patient condition or side effects.